next thing I want to look at is lumbar slash pelvis, lumbar flexion and pelvis posteriorly tilting. So a lot of people that come in that have low back pain, they kind of are in this like chronic state of like extension of the lumbar spine. They have like hypertonicity of their lumbar erectors, and they have a really difficult time dissociating like pelvic movement, and they have a hard time getting out of that position, which is contributing to their pain. So another thing I like to work on and look at is their passive lumbar slash pelvic mobility, so which is just child pose. If they can get into it, can they get into this nice child pose? Do they have a nice round curvature of their pelvis into their lumbar spine? You know, does it all just kind of curve together? You know, there's no flattening of that spine. And then that's the passive way to look at that. And then the active way to look at that is just like cat camel, is now can they be in this position and then go, and can they tilt it under and they still have this nice round part, or does it flatten out? Like, how does that look to their anatomy? And I just have them do it a couple times. If they, you know, can shift back, does that change the curvature of the spine? And I just look at that to be their active mobility of that lumbar flexion and pelvic posterior rotation. Okay, and then how I work on actually controlling that and teaching them how to move a little bit more into that is learning how to dissociate that movement. So I have them go on here, like head down, head on their hands, and then, or head on their forearms, and then have them round. So this is one way people can do that, is just really working on that lower end flexion. Or I have them shift their hips back. And then once again, if they can't do this in quadruped, I might have them go, you know, in standing, and can they do this? And so on and so forth. So sometimes you have to get creative based on people's limitations. If they can't kneel down, then that takes a lot of the exercises that we can do out of the picture, and we just have to go with it.